Out of the healthcare workforce, nurses are at the greatest risk of suicide due to burnout and stress. Nurses have taken on more responsibility and accountability as the role of nursing has evolved in recent years. When approached, many nurses or healthcare workers are open to dialogue regarding suicide, but will not self-report willingly. Physicians, healthcare workers, and nurses are less likely than others to seek out mental health treatment without prompting. Healthcare workers who are proactive and address their mental health needs are able to provide better care for their patients and tend to be more resilient in recurring episodes of depression. In gender comparisons, female nurses are more common than male nurses to commit suicide.
So nurses are often the cornerstone of patient care. Managing all healthcare specialties involved in that patient's care can lead to an overwhelming amount of pressure, and it's a test of one's confidence and self-worth. Fact 2. Researchers from the University of California at San Diego's School of Medicine concluded the first national investigation on nurse suicide and discovered that around suicide incidents to be about 12 suicides per 100,000 female nurses and 40 suicides per 100,000 male nurses, which is higher than the general population of suicides in American men and women. Fact 3. Emergency room nurses have the highest likelihood of experiencing abuse on the job and lack of emotional support due to high work demands. Fact 4. The most important risk factor that predisposes healthcare workers to suicide is depression, lack of self-esteem, and coping capabilities. Fact 5. Suicide among healthcare workers can be significantly decreased by having emotional support, stronger coping capabilities, building self-confidence, and emotional intelligence to identify triggers that may bring about feelings of suicide.
Nurses possess enormous responsibility and accountability for patients and their care. They're the ones that are going to be delivering the high-quality, regulated care. However, it's often difficult to do that under constant pressure and set time limits. As nurses work, stress and ethical dilemmas arise, so nurses can become burnout, leading to suboptimal performances and patient safety issues that have a strong association with depression. The risk factors for nursing suicide can be a combination of depression and insufficient treatment, personal and work-related issues, and stress, smoking, access to means, knowledge of lethal doses of medication, toxic substances, and substance abuse. So as far as the mental health of nurses, many hold themselves to a higher standard. So they might feel shameful or disinclined to confront their own issues as they are trained to help others and not themselves. So the nursing culture around this may not promote the needed assets to deal with mental health or calling nurse suicide related to the stigma. Nurse colleague losses to suicide is more common than is usually acknowledged. When this happens, it's often very silent, avoided, and much denial around the situation. So the grief processes are different for the fellow nurses after they lose someone. They still have to continue to deliver patient care. As far as interventions and practices related to suicide prevention and nurse suicide grief recovery, there isn't a whole lot. So providing programs that enhance wellness while eliminating stigmas and adjustable risk factors through screening could potentially allow for the best practice in nursing suicide prevention. Also, the incorporation of not only these institutional strategies, but individual strategies of self-care, healthy coping, resilience, and modifying the self-perpetuated stigma can add to the prevention of nurse suicide.
Hi, my name is Amanda Mazika, and this is my cat Edgar. And I am and I am the president of Sand Shark Activities Board. Since we could not do this in person as we had originally planned, I am here to present to you some facts and statistics that concern suicide and mental health issues in college students to promote a better awareness. I also want to provide some resources for students who may be experiencing some of these issues, and also to let you know that you are not alone and that there are others that you can reach out to. So, with that being said, I am going to be reading from a document. So, without further ado, according to the American College Health Association, the suicide rate among young adults ages 15 to 24 has tripled since the 1950s, and suicide is currently the second most common cause of death among college students. In a recent study published in Depression and Anxiety, it was found that 1 in 5 students have had thoughts of suicide, with 9% making an attempt and nearly 20% reporting self-injury. 1 in 4 students reported being diagnosed with a mental illness, and a study in 2018 found that at any time within the last 12 months, 41% of students felt so depressed that it was difficult to function, and 62% felt overwhelming anxiety. So, using the Suicide Awareness Voices of Education organization's website, or SAVE for short, here are a few indications that are listed that could mean someone you know needs help or could use some reaching out to. So some of these indications are severe mood swings, a disregard for personal appearance, talking or joking about suicide, making statements of hopelessness, helplessness, or worthlessness, having a preoccupation with death, experiencing withdrawal or loss of interest in activities that were once enjoyed, displaying self-destructive behavior or risk-taking behavior, and there are several other indications that are listed on that website if you do want to check that out. So, as a person seeing this in someone that you know or in one of your loved ones, there are a few things that you can do. So make sure that you are staying involved and keeping in touch with them. When talking, ask open-ended questions. Show that you are genuinely listening to them and avoid criticism or harsh words. Maybe even share some of your own struggles if you feel comfortable enough to do that, and encourage them to take the time to care for themselves. If you are having suicidal thoughts, know that there are resources and people to reach out to. You can contact the National Suicide Prevention Lifeline at 1-800-273-8255 for support and assistance from a trained counselor. Also at this time, I know a lot has been rapidly changing these past few weeks due to COVID-19. And the shift to online classes for the rest of the semester has not really been an easy one. I'm hoping that it gets easier with time. We are staying positive, but USCB is still offering counseling and disability services. You can email them at counseling@uscb.edu or disability@uscb.edu. Or you could contact them by phone, which is listed on the website. And you want to contact them in these ways in order to schedule an appointment. They're offering video and phone appointments. So just know that that resource is still available and free to students. For a list of other sources or other resources that are available, like online tutoring, you can visit the USCB website. I think now more than ever it is really important to keep in touch with each other during this time of quarantine and staying inside. It's really easy to feel isolated because, basically we are physically separated from one another. We're supposed to maintain 6 feet away from other people. So, but that doesn't mean that you still can't contact others. You can invite friends to hang out over Google Hangout, over FaceTime, Skype, Zoom, whatever platform you prefer. and just make sure that you are checking in with one another. It's really easy, again, to feel trapped inside the walls of your home and or wherever else you might be. But make sure that you are still taking care of yourself and maybe even using some of the extra time that you might have on your hands now to discover new hobbies, to pick old hobbies back up, and just making sure that you are doing the things that you love. And with that being said, make sure that you are staying connected and stay safe.
Hey everyone, my name is Samara King and I am the Sandshark Veterans President. Suicide among veterans is a very large and very real issue that we have in America. 43,390 American adults died from suicide in 2017, including 6,139 U.S. veterans. Among U.S. adults, the average number of suicides per day rose from 86.6 in 2005 to 124.4 in 2017. Those numbers included 15.9 veteran suicides per day in 2005 and 16.8 in 2017. In 2017, the suicide rate for veterans was 1.5 times the rate for non-veteran adults, after adjusting the population differences in age and in sex. Firearms were the method of suicide in 70.7% of male veteran suicide attempts and deaths, and 43.2% of female veteran suicide deaths in 2017. Among all the problems that veterans have after transitioning out of the military, the most common are economic disparities, homelessness, social connection, health, and well-being. Veterans enrolled in the Veterans Health Administration, also known as VHA, care was less likely to be employed and had lower income levels than veterans not receiving VHA care. Some veterans report difficulty in transitioning to civilian positions. Their highly developed skills contained in the military may not translate to higher level positions in the civilian world. In addition, unemployment and poverty are correlated with homelessness among veterans. In 2017, the U.S. Department of Housing and Urban Development point-in-time count estimated that 40,000 veterans were homeless and just over 15,300 were living on the street or unsheltered at any given night. Homelessness appears to play a role in suicide for VHA patients. VHA patients with indications of homelessness or who received homelessness-related services had higher rates of suicide than other VHA patients. Isolation has shown to be a risk factor for suicide. Among VHA patients, suicide rates have been found to be highest among those who are divorced, widowed, or never married, and lowest among those who are married. VHA veterans who died by suicide were more likely to have sleep disorders, traumatic brain injury, or pain diagnoses. In addition, mental health diagnoses, including bipolar disorder, personality disorder, substance use, schizophrenia, depression, and anxiety disorders, inpatient mental health care, prior suicide attempts, prior calls to the Veterans Crisis Line, and prior mental health treatment were also associated with greater likelihood.
Hello, my name is Erin McCoy, and I'm an Associate Professor of English and Interdisciplinary Studies at the University of South Carolina, Beaufort. I'm also the Faculty Advisor for Sandshark Veterans, USCB's chapter of the Student Veterans of America. Student veterans comprise approximately 5% of undergraduate enrollment across the United States. That means if you're at an undergraduate institution or a place that teaches undergraduate courses, you're very likely to run into a student veteran. One of the reasons that we, SSV, are participating in Operation SAD is in remembrance of one of our own. In 2017, on March 31st, our friend Nick Becker took his life and referred to himself as the 22nd man, alluding to the fact that 22 veterans a day, approximately, commit suicide. We hope that events like these encourage conversation about mental health on college campuses, as well as suicide awareness, so we can know the signs before someone does something that is irrevocably done. We thank you for your continued support and hope that events like these make for positive change in our world. Thank you.